Patients with end-stage renal disease on hemodialysis face many challenges due to the demands that the treatments place on their physical, social, and mental health. By the end of 2011, over 600,000 individuals were living with end-stage renal disease. End-stage renal disease is the final or fifth stage of chronic kidney disease. When kidneys are functioning below 10 to 15% their normal capacity, they cannot effectively remove waste or excess fluid from the blood. There is no cure for end-stage renal disease. Dialysis and renal transplantation are life-sustaining treatment options. Choosing no interventional therapy will lead to eventual death, but it is an individual patient choice for a treatment option. Quality of life is a broad concept. In basic terms, quality of life is one's ability to enjoy life. And as a provider, it is important to focus not only on the disease process and treatment options, but also on the individual's quality of life, and help that patient maximize their well-being. A literature search for end-stage renal disease, quality of life, and self-management from 1990 to 2014 was completed. A systematic review yielded 81 research studies. 5 of those are reviewed here. Kehoe and Fihali found that transplant patients have higher acceptance of illness and better adjustment scores than hemodialysis patients or peritoneal dialysis patients. Wells in 2011, studying educational intervention and end-stage renal disease treatment patient adherence, her study finds that one-on-one education does increase knowledge about end-stage renal disease and hemodialysis, but no significant treatment regimen compliance has been noted. In 2011, Lingerfelt and Thornton also reported findings that indicated improved knowledge with one-on-one education sessions with dialysis patients. But neither of these studies tested patients' knowledge of the disease or treatment process on a long-term retention basis. In 2009, Kring and Crane completed a study that suggested end-stage renal disease patients adjusted their life aspirations according to the changes necessary to live on dialysis. End-stage renal disease patient quality of life index scores reflect threatened loss of independence, and this is similar to the quality of life scores of patients with a chronic illness such as spinal cord injuries. Clarkson and Robinson did a study, and their findings were similar to Kring and Crane, showing that quality of life scores for end-stage renal disease patients are linked to the role changes that they must make to adapt to a life on dialysis. Focusing patient education on teaching patients about the progression of chronic kidney disease and the patient's responsibility to promote self-care and possibly preventing progression to end-stage renal disease. Open discussions about treatment options, being outpatient hemodialysis, home therapy hemodialysis or peritoneal dialysis, renal transplant, or no treatment. Depending on the treatment of choice, access management must be discussed. Timing of the placement of and maintenance of a central venous catheter, arteriovenous fistula, arteriovenous graft, and a peritoneal catheter. Education and reinforcement of self-management skills can be obtained. Patients in the outpatient hemodialysis setting can weigh themselves, obtain their own temperature, clean their access sites, and many have even been taught to cannulate themselves with blunt needles through a buttonhole technique. Encouraging compliance with hemodialysis treatments, coming to the treatments, staying for their entire prescribed time is needed to maintain optimal health and hopefully improve quality of life for each individual hemodialysis patient. To maximize individual hemodialysis patient quality of life, patients need initial education in the clinician's office prior to stage 3 chronic kidney disease diagnosis, followed with a referral to a nephrology specialist. Re-educate frequently, keeping the patient up to date on the progression of his disease, and time access placement before the initiation of dialysis, schedule a patient tour of the outpatient dialysis facility, and educate the patient on treatment options. Dialysis staff have weekly contact with hemodialysis patients and the opportunity to support end-stage renal disease and hemodialysis education. Hemodialysis providers should intervene to promote self-management skills and encourage compliance from the individual patient.